Welcome to Anatomy Head and Neck video series. Today we will talk about oral cavity. Let's begin and talk and say that oral cavity is divided into two parts, and the division is by upper and lower dental arches. We have oral vestipule and oral cavity proper. Oral vestipule, it's the part that comes between dental arches and deep surfaces of the cheeks and lips. We see here that here is the closed arches. Here is the closed dental arches, and this space along below the lips and the cheeks until we reach the lower and upper arches. There is the oral vestipule, and oral cavity proper is the cavity that is enclosed by the dental arches. If we see here the cavity, we see here the cavity inside the dental arches, we can see it here very clearly. This is the oral cavity proper here. Okay, let's talk about walls of the oral cavity, mainly the cheeks. The cheeks, they are the lateral wall of the oral cavity. They are covered by skin. Also skeletal muscles, mainly Buccal muscle, one that we can see here. This is the Buccal muscle, and it's sandwiched externally by the skin, internally by the oral mucosa. Cheeks form the lateral wall of oral cavity. It's innervated by the buccal nerve. Now this one, buccal nerve, that is come between the lateral pterygoid muscle heads. You can see it from here. Here's the buccal nerve that is innervating the Buccal muscle and the cheeks. It's come between, through its course, it's come between the lateral pterygoid muscle head. Here's one head, inferior head, and we can see above it the superior head, mainly if we remove these muscles. Here we can see the superior head of lateral pterygoid muscle. Here's the inferior head, and this is the buccal nerve. And the nerve or blood supply of the cheeks will be also the buccal artery, which we can see here. If we talk about the floor of oral cavity, floor is formed by three structures or three layers. First one, it's the diaphragm, which is formed by two mylohyoid muscle. It's a U-shaped gap filling the gap between mandibular borders, and it's formed by the mylohyoid muscle. Above the mylohyoid we have the geniohyoid muscle. And also forming the floor of oral cavity we have the tongue, which is superior to geniohyoid muscle. Here we can see the tongue. In the next video we will talk about the roof of oral cavity, hard palate, soft palate, and the details about them. See you in the next video.